Hey folks, Will Brink here, www.brinkzone.com, and today I want to cover a very contentious topic, which is doctors and nutrition. This is a big area of confusion for people, and maybe some of the facts I'm going to give out will help you understand where the issue or why this is such a contentious problem. A review done some years ago looking at the requirements of medical schools found that of the approximately 130 medical schools in the U.S., less than 12 required a single course of nutrition. And that was some years ago. A more recent review, survey paper actually, that surveyed medical schools found that it not only had it not improved, it actually got worse. And I believe it was somewhere in the 6 to 7% range of graduating medical doctors from medical school have had any formal nutrition training whatsoever. And by that I would say at least one course. Usually they do it in terms of hours of training. Regardless, I think that should tell you that the vast majority of medical doctors are not well versed in nutrition. And that's somewhat understandable, to be honest with you, because this is a science. Nutrition is a science unto itself. It's not something you go to medical school for and take a few classes and come out and you are an expert in nutrition. Do I think that doctors as a rule should have a better grounding and foundation in nutrition? Absolutely. I think this would benefit them. It would benefit their patients. I would think it probably ought to be incorporated to more of a degree in their undergrad studies and somewhat in their medical studies, but at the same time, remember, doctors do have an awful lot to learn. They have a lot to retain. They have specialties to go on to, and asking them to know everything, including nutrition, is simply unrealistic. And that brings us around to another problem, which is to say that there is also, on the patient side, there are unrealistic expectations of medical doctors, and most people want their doctors to know everything. And this puts them in a tough spot, because now they either have to admit they don't know a thing, or they have to, unfortunately, give out often incorrect information. And this is what causes, well, confusion, resentment, problems. And, doctors are high-level, high-trained professionals, and it is not easy for them to basically say, I don't know. Like I say, it puts them in both a difficult spot from a patient perspective. It also puts them in a difficult spot on a personal perspective. I mean, let's admit, they have their own egos. And nobody in a certain profession, regardless, likes to say, I don't know. I think that people that are better at what they do or comfortable at what they do are okay. I mean, but I don't like to say it in a seminar. I don't like to say it when I'm talking to people when they say, what do you think of X diet? And I have to say, I don't know. I haven't looked at it. I haven't studied it. I can get back to you. I think what doctors will do is either say, let me look into that and get back to you, let me refer you to somebody, but at the end of the day, understand that doctors are not, as a rule, a good resource to get nutrition information from, and you shouldn't expect them to be. Now, again, I do think clearly they would benefit, and we would all benefit if they had a, let's say, a standardized base of nutrition knowledge to at least they could work from, but they really don't. Now, there are some doctors, of course, that are really good at nutrition, but they tend to be the doctors that have gone and done the research on their own and looked into this. Now, maybe they had an undergrad in nutrition and did more research when they got out. It could be any number of things, but as a rule, if they're good at nutrition, it's because they've taken the time to incorporate the information into their practice, and that's great. And some of them are very good at it. But as a rule, again, the reason you hear so much conflicting information is that they are not by nature well versed in nutrition. So that should explain some confusion to you. I'm sure, maybe the question you're asking is, well, why do they give out information? Why are they giving me advice? And again, I think a lot of it has to do with expectations of the patient. I think it has to do somewhat with the pressure the doctor feels, somewhat with just, professional ego. But understand they are not, as a rule, terribly qualified to give nutrition advice, and that's just the way that works. And again, I don't really have a major problem with that. I want my doctor who's doing brain surgery to focus on brain surgery. I want him to be a specialist at his specialty and work on that, focus on that. I don't really necessarily want this person spending all their time trying to understand nutrition when I really want them to be a specialist at what they're doing. I do think they should at least be able to say, that's not my area of expertise, I don't know. I will refer you to somebody, I'll look into it, what have you, but again, I've covered why I think that is the case. Now, nutritionists, on the other hand, that's another story, and that will be my next video to discuss the issue of nutritionists understanding nutrition. But I hope this gives you some decent info on where all these problems come from when it comes to doctors and nutrition. And if you enjoyed it, please hit the likes. And I do recommend that you subscribe to this channel, because you see I give it a lot of science-based insider information you may not find on other channels. And I'll see you all on the Brink Zone.